Hey guys, I'm Vivek Gaur, your cool physical therapist. Friends, I am a practicing physical therapist as well as an educator. Today's video is dedicated to auscultation of heart. In today's video, we are going to see how precisely you have to listen to the heart sounds and how you have to carry on it as a practice. Listening to heart sound was my favorite topic during my undergraduate studies, and I actually spent quite a lot of time listening to patients' heart sounds. So under student membership program, I have decided to make an entire series on auscultation of heart and describing the different heart sounds to you. So let's get started, and we start with first taking patient's consent for the examination. Hello.
Hi.
I will be auscultating your heart today and the surrounding area.
Okay.
Do I have your permission?
Yeah, sure.
Please lie down. The first part is where we ask the patient to lie down supine in decupitous position. In this position, patient has to lie down supine on his back with his head and shoulder lifted 30 to 40 degree up. Once your patient has undressed and you have made them lie supine on their back, then the examination of chest starts. The first step, even before auscultation, is inspection of chest. So just by having a look at the chest wall, you see any visible abnormality that might be associated with the cardiac problem as well. For example, you look for visible chest abnormalities like pectus carinatum, which is a bird-like shape of chest where the sternum protrudes forward, as well as pectus excavatum, where the sternum is visibly depressed in the chest wall, where both chest walls actually bulge outside. Both of these problems might have underlying disorders associated with them. For example, Marfan syndrome, Noonan syndrome, as well as Turner's syndrome. In these syndromes, there are connective tissue disorders which might affect patient's heart as well. For example, in Marfan syndrome, a patient might have aortic root problem as well as mitral stenosis. Whereas in Noonan syndrome, a patient might have pulmonic stenosis, atrial septal defect, as well as hypertrophic cardiomegaly. Other than this, during inspection, you have to look for any visible scar on the sternum of patient. If the patient has been a cardiac patient before, they may have gone open heart surgery or bypass surgery, from which the scar might be left on the chest wall. Of course, with problem like right heart failure as well as restrictive pericarditis, a patient might have visible jugular vein prominence, which can be seen and detected when your patient lies supine, as well as you turn their head to one side and see the visibility of jugular veins on the side of their neck. After you have finished inspection of the chest, the second step is palpation of the chest. So the first thing that you do is palpate for the apical impulse. For that, you need to locate the fifth intercostal space on left of chest wall and stay little medial to the mid-axillary line. There, with the help of 3 fingertips or with the help of your palm, you can feel the apical impulse. Remember, apical impulse is only in the area of 2 to 3 centimeter in this area. Any shifting or moving towards axilla or downward indicates left ventricular hypertrophy. The second thing to look for is the central precordial heave, where you put your hand right over the sternum and feel any abnormal rise of sternum upward with heartbeat. This might happen during the right ventricular hypertrophy. Other than this, if you put your hand on the left side of chest wall and you feel the apical impulse that has moved downwards or more towards axilla, this might suggest the left ventricular hypertrophy. Alright, so we come to the auscultation part. You can see this is a stethoscope which has the ear part, tube, and over here you can see there is a diaphragm and a bell. So you can see the diaphragm is larger ring, and this is used for listening the high pitched sounds. For example, S1 and S2 heart sounds. Over here is the bell, which is actually used to listen the low pitch sound like rumbling, murmurs and rubs. The auscultation of heart begins in supine decupitous position. So you listen for the apical impulse first. For young clinician, it is always good to check if your stethoscope is working or not. The first step is to do the surface marking of the chest. So first you palpate the sternal notch, and 3 to 4 centimeter below it is the sternal angle. Then you palpate the individual intercostal spaces and reach to the 5th intercostal space just medial to the mid axillary line. There you are listening to the apical impulse as well as the mitral valve. In patients who are obese or with too feeble heart sounds, you can ask the patient to lie in the left lateral position, where you can more clearly listen to the mitral valve area. After this, you move to the 4th intercostal space, where you listen to the tricuspid area, the tricuspid valve. Then you move on to one space up, which is the 3rd intercostal space, where you listen to the Erb's point, where all normal and pathological heart sounds are heard. Now move your stethoscope to 2nd intercostal space on left, where you listen to the pulmonic valve. And right opposite it, in the 2nd intercostal space on right of chest, is your aortic valve area. And subsequently move to the right border of sternum till 4th or 5th intercostal space. At all these spaces, you have to listen to the intensity, rhythm as well as duration of heart sounds. Once this is all done, now listen to the particular valvular area, the pulmonic area in the left 2nd intercostal space, the aortic area in right 2nd intercostal space, the tricuspid area in 4th intercostal space on left of sternum, the mitral area on the 5th intercostal space medial to the mid-axillary line, and also place the diaphragm of your stethoscope on the anterior axillary line in axilla of the patient's chest wall. Once you have heard the heart sounds clearly with the diaphragm of the stethoscope, now turn around the diaphragm and put the bell of the stethoscope on these respective valvular areas. Make sure you are not pressing too hard on the bell, because then your skin becomes the diaphragm and it starts vibrating. So you are listening to the low pitch sounds and try not to press too hard with the bell on these valvular areas. Now place the bell of the diaphragm in patient's axilla. So if a patient is having mitral regurgitation, the heart sound of mitral regurgitation, which is a very particular murmur, might actually radiate towards the axilla. Now place the bell over the clavicle bone and listen clearly for any heart sound that is originating from here. Now move the bell of the stethoscope right over the carotid area on right and respectively on the left side, and listen for the heart sounds again. If there is murmur of the aortic stenosis, they can also be heard on the carotid arteries in your neck. Now ask patient to sit and hunch forward and place the diaphragm of your stethoscope on his back and listen for any heart sound that might be coming over there as well. Alright everybody, so that's how you actually auscultate the heart. It is not actually as fancy as you see in movies and TV series. That means it's not done in matter of seconds. You actually need to spend good time with your patients, and the steps that I taught you before, like inspection and palpation of chest wall, is very important if you are actually going to make the auscultation of heart correctly. So that's it. Today's video ends over here. I would like to point it out that if you have not joined the student membership on YouTube, please join it, because this video is definitely not under the student membership, but it's available for everybody. But all the other videos coming in this series and more videos, all other video of this series, like I'll be speaking about normal heart sounds, then I'll be describing you the abnormal heart sounds, and you'll be listening to the actual clip of these heart sounds, normal and abnormal both, and many more such content will be coming on the student membership program, and all of those videos will be completely under the membership, so you might actually not see them over here under the free video series. So I would request you to join the student membership program. If you have some friends whom you think would be benefited out of it, you can refer them our channel as well. I would like you to join the Telegram page that I have made. It's a group, and I'll be sharing the notes over there. You can also check my notes on my website, which is www.physiovivek.com. I also make podcasts, and you can listen to my podcast on Spotify as well as Castbox. You can find me on Spotify by typing my name, Vivek Gaur Physiotherapist, and that's where you can listen to my podcast. If you have any query related to today's video or the student membership program, you can contact me by posting your comment in this video section. You can also check the student membership link in the description box below. So today's video end over here, and I'll see you soon in a next video. Keep moving, keep fit, stay healthy. I am Vivek Gaur, your cool physical therapist. Bye-bye.